Hi there, this is Dr. Jenny Yoon. Welcome back. This is number 3 of our 4 series that we call Protecting the Girls. Today we're going to talk about breast cancer and sexual dysfunction that result as part of this breast cancer treatment. You know, when you're diagnosed, the last thing on your mind is having sex. It may not be important to you now, but when you get through treatment and you're trying to resume your life with your significant other, it may become very important. You know, I remember telling this beautiful young patient of mine that she had breast cancer. She was about 30 years old at the time. And the first thing she said was, instead of saying, how do I treat this cancer so I can live, she told me, my husband is a breast guy. So then I realized how important the sexual aspect of breast is and how breast cancer affects, you know, one's self-image as well as relationship with your partner. So today, that's what we're going to talk about. You know, sexual dysfunction. It's important because it is an important aspect of our daily life, and being diagnosed with breast cancer can wreak havoc on your intimacy and sexuality. Not because breast cancer is a serious illness that you have to get through, but because it changes you physically and emotionally. Breast cancer treatment is unique in that some of the treatments can put you either in temporary or permanent menopause, and having to go through this rigorous treatment protocol of having surgery, radiation, maybe chemotherapy, is going to make you bone dead tired. And the last thing you want to think about is sex. And some of the medications you're going to get is going to make you depressed. Chemotherapy drugs are going to, you know, further hinder your appearance and your self-image by making you lose all the hair. But none of these are as important as the aspect of actually losing your breast that is brought on by surgery. And sexual side effects can linger long after breast cancer treatment stops. According to the National Cancer Institute, 1 out of 2 women undergoing breast cancer treatment report some sort of long-term sexual dysfunction. It's scary, but the good news is that there is sex after breast cancer if you let yourself just embrace this new you. You work so hard to survive this breast cancer, and you sacrifice so much to live. So once you survived it and you finished your treatment, why won't you live? I mean, really live. Why get stuck worrying about not looking the same or worrying about you're never going to look the same? Why do that? You just need to open your eyes and see how beautiful your new world could be. People who love you still love you, especially your partner. Just because you lost a breast, he hasn't stopped loving you. You need to embrace this new body. And if you do that, others will follow. I'll tell you a story of a patient. She was diagnosed with breast cancer at age 32. She decided to have both of her breasts removed and have them reconstructed. And she didn't want to deal with nipple reconstruction, so she just had breasts without nipples. And her children grew up looking at her just like that, and they thought that was normal. One day her teenage son came home and he was distraught. She asked him why, and he said, my girlfriend is a mutant. She said, why is that? And he said, well, she's got these things growing on her breast, meaning nipples. So it's all about what's normal. You know, if you have this new body and your partner and your family get used to seeing this new body, then that may become their normal. So you just have to allow these people around you to get used to this new body that you have. And in order to resume this normal life, you need to know what causes sexual problems and how you deal with them. You know, you're missing either part if you had a lumpectomy or all of your breasts if you had a mastectomy. But it's unlikely that people around you stop, you know, loving you because you don't have this breast. Breast can be a big part of your sexuality, But you got to remember that most relationships aren't solely based on you having this breast. And one of the ways that you can get your partner adjusted to this new person and new body is you have to involve this person in this treatment process. I remember this female oncologist telling a husband's patient who was just diagnosed with breast cancer, she said, you need to stay out of her way because it's time to treat your wife. And I thought, how stupid is that? This is the person who's going to help her through it. He's going to be her support. And he has to get used to this new body of his wife. Yet the oncologist is telling him to stay out of it. If you don't involve him, how do you figure he's going to get adjusted to this new body and new person? And how is he going to help you get through it? So you need to take steps towards this new life, new body with your partner. And you have to have this common goal, which is more important than what your body looks like. That is to save your life. And by doing so, you can make your relationship grow stronger. And it may be helpful for you and your partner to look at pictures of women who've undergone mastectomy or lumpectomy to know what your realistic expectations should be. So you go in it knowing what you're going to look like once you come out of surgery. This is a journey you have to take together. You have to communicate with each other. You have to tell each other what you're comfortable with and what you're not. And you know, it's common to hear patients say, well, he won't touch me anymore. But you have to consider, did you ever think that you just looked at this, you know, death in the face about 2-3 months ago when you were diagnosed? And maybe he's just scared, and maybe he thinks you're still too fragile. So you need to tell him that you're okay, you're strong enough to have sex, and you need to make the first move if you need to. And if, you know, breast was a big part of your sort of this erogenous zone before you started this treatment, you need to consider breast is just a small part of your body. You got this 95% plus body part that you can explore. So, and you might find that there are other parts of the body that give you more pleasure than breast ever did. And if you aren't ready to go naked and show your new body, well, cover it up with lingerie or feathers or whatever makes you happy. This is an opportunity for you to go shopping, and you can indulge yourself in whatever strikes your fancy. You may be mentally ready, but your body may not cooperate because some of the drugs that are used will put you in menopause. So with menopause comes multiple symptoms, and one of those is vaginal dryness and other problems down there that can lead to painful sex. But the thing is, there's a solution. I tell people, well, you need to get what I call getting my groove back toolkit. And that can include vaginal moisturizers. It's like any other moisturizer. It can help you lubricate, regain elasticity, and there are things called vaginal dilators that can stretch your body so sex isn't painful. And there's a whole slew of sex toys you can buy. And if you haven't ventured into that area, experts say go and see what's in front of you. It's all a matter of how much and how little you want to put into this toolbox. And some of the women tell me, you know, before I had my breast cancer treatment, I used to let my husband do all the work. Now she's a full participant. And you may find that different positions give you less discomfort. So you need to find what that is. You need to explore. You know, there are many women out there. I told you on the first show there are 2.5 million survivors of breast cancer. And a lot of those women are having normal sex life. And if you know all this knowledge about what the treatment does to you and how you treat that, you can be one of these women who live very full, happy lives. You control your life. Don't let breast cancer dictate how you live. You fought so hard to beat this thing, so why not live a full life? Remember, breast cancer can be diagnosed early. Can be cured if we diagnose it early by doing breast self-exam every month, getting a mammogram every year, and seeing a doctor on a regular basis. That's how we protect the girls. This is Dr. Jenny Yoon. See you next time.